our system to really educate young adults, males better, and we're working on that and looking at that.
Good afternoon. My question is, what are some examples of systematic institutional changes that you feel would have to be made to institute or a partnership between school districts and health and human service agencies, and how do you feel some of these changes would best occur?
Well, there are lots of models nationally, and certainly there are a lot of good examples here in Ohio. In Ohio, a lot of that funding goes through the county system and then gets deployed in the community system. And, there are ways in which we can link health and human services to a particular area where we can form relationships with social service agencies that can communicate with teachers and schools better and more comprehensively to ensure that children come to school ready to learn and that they come from strong families and strong communities. There's some very interesting research coming out of New York in terms of the Holland's Children's Zone, where, again, a particular area is linked to health and human services and that type of support. There are models across the country and also some in Ohio in terms of full-service schools where health and human service providers are really housed within that school and are serving the needs of children and family. And for example, the first model, one of those first models was here in Ohio in the Dawson-Bryant School District.
Dr. Zelman, if you are serious about raising expectations for a student, it seems to me there's no better place to begin than with an individual learning plan or something that is sensitive to the realities of that student. I submit the real individual learning plan needs to be one that is set in a family context, on the theory that the learning unit is not a free-floating student, but a student lodged in a family setting. But I've actually never heard of the notion that an individual learning plan isn't complete until it takes account of the family setting in which the student is trying to be a learner. I wonder if we would begin to bang into theoretical or political problems if the schools were to be more aggressive about saying we have to know about what's happening at home, what is the learning context, what learning environment does this student have when the student is not in our charge?
Well, that's a very provocative question. When we talk about education, of course, we always talk about the relationship between the student, the curriculum, the teacher in the context. And part of that context involves both the family and the community in which the student comes from. I would see us as educators working in partnership with our parents, with our community in supporting that individualized instruction and plan for our students. So that's part of our vision, but the relationship with school and the family certainly should be voluntary and in the spirit of partnership.
Dr. Zelman, does Ohio's current educational structure with over 600 individualized, very parochial school districts still have a place in a global, changing world of knowledge? Or would a more regionalized approach to learning, perhaps at a county-wide level, best serve our students and our state in the years to come?
Well, that's a really good, provocative question. And if you look at Maine or Arkansas or other states, you see some states beginning to work on the whole issue of consolidation and cost effectiveness. In Ohio, we have a very strong tradition of local control. And before we do anything, I think it's important to also think about the social capital that a school brings to its local community in a variety of different ways. So I think it's a really complex question, but deserves a great deal of thought about how to approach that. And there might be other ways to get efficiencies and synergies across districts than massive consolidation.
Doctor, you've expressed quite a vision for education in Ohio. Would you give us your impression as to what impact the governor's proposed changes would have on that vision?
Well, I think that, for the children of Ohio, the best is yet to come. And I'm sure that the governor will, hopefully working in collaboration with our State Board of Education, go out for a series of public engagement around the state this fall. I know that he's very interested in getting input from a variety of different stakeholders, and I'm very optimistic that we will be able to move Ohio's education system to its next level and create that political will to do so.
Today at the City Club of Cleveland Forum, we have been listening to Dr. Susan Tave Zelman, Superintendent of Public Instruction at the Ohio Department of Education. Thank you, Dr. Zelman. Thank you, ladies and gentlemen. This forum is now adjourned.